your dad never wanted to give up, and I always try and phrase hospice as what it is. Hospice is not giving up. It is treating this disease in a different way.
Hi, this is Patrick.
And this is Laura.
And you're listening to This is Cancer.
Brought to you by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis, national leaders in cancer. So this is going to be a pretty personal episode, wouldn't you say, Patrick?
Oh, yeah, definitely.
Yeah, and I appreciate you being so open and vulnerable on this one because it's just a lot. But for those of you that have not listened to the podcast before, not only is Patrick a lung cancer survivor, he's also been a staunch, relentless, and amazing advocate and caretaker for his dad, who passed away a year and a half ago from skin cancer. So today we're going to be talking about his dad, his diagnosis, what it was like to care for him during the time of fighting the disease and care for him towards the end of his life, and also speak with his amazing doctor, Dr. Keller at Siteman Cancer Center. So we're going to have some pretty deep and emotional, but also helpful conversations throughout this. Let's start with you telling us a little bit about your dad and what his diagnosis was.
Yeah, my dad was the best. Hilarious, very kind man, very faithful throughout his whole battle with cancer, always led by example, even in death. That's, I feel like I learned how to die from helping him through, the end of his life. But I can't say enough good things about my dad. He was hilarious and the best, and my best friend. But in relation to his, his treatment, we started and ended with Siteman. We were with Siteman from day one once we found out that he had cancer.
And what kind of cancer did he have?
He was diagnosed with stage 3C melanoma. They found it in summer of 15. He was in the shower and just kind of felt something underneath his armpit. And, melanoma, skin cancer, I think a lot of times people think of like moles and stuff. Melanoma, once it's internalized in your body, I think is if not one of the deadliest forms of cancer. And so, starting at 3C, it's not great. So I still remember driving home from work. I was freelancing, and he called me and he said, "Can you come home this weekend?" And I immediately knew something was wrong. He didn't say, "Let's go golfing, let's go to a baseball game." He said, "Can you come home this weekend?" I said, "Yep, what's going on? Is it mom or is it you?" And he goes, "You're such a spaz. Just come home and I'll talk to you when you get here." And this is how my dad was caring about everybody else. So he had everybody over to their house, was grilling steaks, made sure everybody had a beer, and made sure everybody was in a good mood and together. And that's when he told us that he had cancer and that he had met with somebody at Siteman, but they had a plan and they were going to start treatment. So kind of similar to me, there was a plan in place. They ran the best play in the book at his type of cancer, and they kept him alive for a really long time. It was an uphill battle right out of the gate. Really wish we could have just found it sooner, but it wasn't the way it went. You do tests. What kind of mutation do you have? This kind of treatment works for it, but it's in his, it was in his armpit. So they had a surgery and they took out all the lymph nodes under his right arm. And it was all 24 lymph nodes that they took out. So again, we kind of knew we were up against it from the get-go. But he was on a 2-pill cocktail for about 2 years, and it worked for a while, but there's a limited shelf life of efficacy for those particular drugs. We knew that right out of the gate. They worked for a number of years, stopped working, things started growing. We switch, and now, 2 years into his 6-year battle, we're already into clinical trial mode and just throwing whatever we can at it. We used to use the funniest analogies, and the doctors would always laugh because my dad and I are like, we're sports guys. Would take on like a coach's mentality in these sessions with them. And I'd be like, we're on the 20-yard line here. We got, it's first down. Like, I want to run it up the gut twice before I put this ball in the air, and the doctors would be looking at me like, no, I don't know what you mean, but it makes you feel better. We can talk about it that way. From the get-go, the plan was to beat it. There was no it wasn't until we got into hospice that we somewhat yielded to cancer. I'll tell you now, even at the end, my dad was fighting to get insurers down, to get his calories up, to keep his energy up while in hospice, because a lot of people, there's just no quit in them. Once you quit, once you stop trying, it's like when someone retires and they just like die because they stop moving, like he never, ever, ever quit. The concept of giving up to cancer, like never took root. Even the realization of like, I'm in hospice, like he knew he was dying. Insurers aren't tasting good, but he would still be like, I gotta get 2 of these down today. So 100% the whole time we had a winning mentality, and our doctors did too. And my dad's first oncologist with Siteman was Dr. Gerald Lynette, who's a brilliant oncologist and brilliant in his field of melanoma treatment. And we were with Dr. Lynette for about 2 years. And then Dr. Lynette moved on to start some clinical trials of his own. And we transitioned over to another doctor who worked directly under Dr. Lynette, and that was Dr. Jesse Keller, who was just a really sharp young oncologist and handled my dad very well. I mean, my dad is a lot like me. So, I mean,
stubborn.
You can imagine, like, we're very direct.
Stubborn.
Yeah, stubborn. Like, I don't know, we push people, and the people at Siteman, like not just the doctors, but the nurse practitioners, Joanne, the nurse practitioner coordinator who's since retired. We had her phone number on speed dial. Like, you develop relationships with these people, and they knew how to handle my dad. My dad knew how he could push them. Let's get this scan now, not next week. I don't want to come back in a week. Let's just do it now.
He also did not live in St. Louis. He lived in Springfield.
We're from Springfield, Illinois. So this is every week, every other week. We made a thing out of it. That's another thing about my dad is his attitude was, his spirit was unflappable. When he got diagnosed with cancer, he's like, well, I don't know, we'll get some Joyas every Wednesday, I guess. We're gonna have some fun with this. I mean, there were Wednesdays he'd come down to get treatment, and we'd go to Milo's on the Hill, have a couple beers, go see the Cards play.
It's about a 90-minute drive from Springfield, right?
Yeah. Mm-hmm. Make a day out of it. He did not let cancer set the tone in his life, and he said as much. He would always say, I'm not going to let this dictate what I do. I'm in charge of what I do and how I respond to it. And he'd also say, I'm not going to thrash about, which at first I used to think that was like kind of weak, I guess, like, because I thought he meant he wasn't going to get in the muck with like clinical trials and stuff. I think what he really meant, though, is that he just wasn't going to like make a scene, because he fought as aggressively as anyone possibly could. We were prepared to try this experiment in Philly that Dr. Lynette was brewing with T cells, and my dad would have been like the 9th guy to do it, but he didn't make it that long. We would always make these sports analogies. We would always say, like, I just want to stay in the game. Like, my dad would say, like, I feel like a pitcher on the mound right now, and it's the 9th inning, and I'm a little over 100 pitches, and the manager really wants to take me out, but I swear to God I can strike this next guy out. Just keep me in the game. So we would always say, if the scan came back bad and we realized it was time to get off the treatment that we were on and switch to another clinical trial, if it's going to keep me in the game, let's do it. So that was the mentality the whole time.
What do you think you learned from him the most what do you think he taught you, or what advice did he give you when you were going through your battle that stuck with you?
He did it more with actions, which is a whole other thing about his parenting. He'd always say, show me, don't tell me. It did not ruin his mood, ever. He made every appointment. He did everything he was supposed to do. He didn't complain about it. To make another sports analogy, I don't know how you pitch a better game. We still lost, but he pitched a perfect game, So there's so many lessons in there, for me, like when I have to go, to my own consultations, I'm a good personal advocate because he was pretty good, but I was his advocate as well. So I learned how to push people, how to push people in the medical field too. Not because they're not doing their best, but because they're busy. And sometimes if you're direct with them and like lay out your comfort level, then it might change like how they advise you. Whereas one doctor might say, like, let's try this medicine for like 3 weeks and see how it feels. You might go, can I call you in a week? And if I don't like it, can we have another medication lined up in case I don't like it so we can keep this thing moving? Nothing wrong with that suggestion of like, try this for 3 weeks and come back. But because my dad and I are people that like, you know, it's like my business acumen. Like, I want results. I want effort. I want to see action. And these people knew that we wanted to see effort, results, and action, and they acted accordingly. These people would bend over backwards to make sure that my dad's driving 90 minutes down from Springfield to get treatment. Why don't you tie in the scan that he's supposed to get next week on that same visit so he doesn't have to do this twice? Might be a bit of a scheduling headache, but can you do it? And they'd go, yep. So it's, again, going to sound like home cooking, but I can't say enough about Siteman. I'm going to say a bunch of it on this podcast because I spent a lot of time there with the most important person in my life, and I never felt like he wasn't getting exactly what he needed. So I learned a lot from him by going through it with him. As you mentioned, he'd come down from Springfield, Illinois. That's a 90-minute drive. I live in St. Louis, and I'm the only one in my family that lives here.
And that's kind of how you became his advocate, more or less, too.
Cancer conciliary is what we would call me. You know, like my brother, sister, and mom, and the rest of the family would take care of him like day to day, and then in Springfield, cooking and this and that, and I was the big picture guy.
One of the things in this podcast that we're going to talk about is the importance of advocacy and the toll this takes on caretakers.
Yeah.
So one of your biggest takeaways from being your dad's medical advocate and what you learned through that process. Because I feel like if I ever go through cancer, I'm calling you, not my husband.
Oh, man. Mike would rise to the challenge.
I mean, I do have to put calendar invites for everything he does.
Yeah. It comes.
Use the bathroom at 3 o'clock.
I will say, sadly, it comes with experience. The first consults that I would have with my dad and even my own, my head would just be spinning, because you're just trying to wrap your head around this life-changing news that you're getting. And that's a lot of pressure on a doctor and a medical staff to like take the time to be very deliberate and sensitive and make sure that the patient is absorbing this information and having an opportunity to ask questions. And they're doing this, unfortunately, all day. So it is absolutely essential to have someone there as your advocate, as a patient. And yeah, that's the role that I ended up filling for my dad a lot of the time.
I remember towards the end, you getting phone calls all day.
Every day. All day, every
Long.
day.
Mm-hmm.
That was more the rotation of hospice nurses.
You were still advocating. You didn't get done advocating because you weren't dealing with doctors anymore. You were still advocating till his last breath. What did you take away from that experience that you could share or relate to that other people are doing it or are about to go do it?
Just how important that role really is, because the patient's head's spinning. Yours probably will be as an advocate too. And, the doctors aren't mind readers. So once I eased into the role as advocate for my dad, I just became like a bulldog lawyer, basically. I was never rude, but I took it on as my job to facilitate action and get results. So before every meeting, I would call my dad. What questions do you have? How have you been feeling? I knew my dad. We get in there. Paul, how you been feeling? Pretty good. No, he's not feeling good. He worked 4 hours yesterday. He came home and laid down on the floor. He was so tired. So you're a snitch on the patient and you're a bulldog against the doctors. What's really going on here? Let's get it out on the table and let's do something about it. But, thinking about what questions to ask ahead of time, making a list of those questions, making sure they get asked in the room, following up on questions, truly hearing what is said in the room, and if you're quick enough on your feet, anticipating what problems might come out of that and asking like follow-up questions, kind of like let's try this treatment for 3 weeks if we don't like it. So I feel like I kind of saw some doctors actually becoming more empowered by learning to say yes to some of the things I would push them for by asking for it.
Mm-hmm.
It made me a better producer in our field.
Mm-hmm.
I will ask anything of anybody. And there's a right way to do it. You don't have to be mean.
100%.
You don't have to be pushy about it.
It's just a question.
Just ask. Say no. If you can't do it, say no. But
It's just a
Don't
question.
worry about hurting people's feelings and this and that. Like, you're there to get things done. And as the advocate, you're trying to keep your eye on the prize, which is helping this person beat or survive cancer. So, you don't have to be a jerk about it, but you do need to be like firm is what I would say. That's how I was. I ended up getting very friendly with everybody on my dad's team, but I definitely came out of the gate with everybody kind of like baring my teeth.
Right. Well, I mean, you had a reason to fight. Your dad was amazing. I had the pleasure of meeting him several times. I met him at your wedding, spent some time with him at your surgery, met him at our old place. He truly was loved and respected by so many people. I told him at your wedding, I knew exactly where Patrick came from because I saw it all over your dad. You know how I feel about you, and I know you take so much from your dad, so I'm super proud of the way you advocated and cared for him, and I know he is so super proud of you.
Well, thank you. That's very kind. He was the best. He put up a hell of a fight. I was proud to be in his corner throughout all of it, and again, home field cooking, it's going to sound like it, but again, I was so thankful that we were able to do it all at Siteman. Getting a cancer diagnosis can really flip your world upside down.
Yeah, I know from talking with you, Patrick, and my sister and other family members that it's just so taxing on you mentally.
Absolutely, and I think that's why it's so great that Siteman Cancer Center offers psychological services free of charge to their patients and anybody in their family or their caregivers that might be going through just a tough time when you're in this cancer battle.
So even if your care isn't provided by Siteman, you can still go to their website and get great information on the emotional concerns associated with cancer, like anxiety disorder, depression, or post-traumatic stress disorder. For more information on that, click the link in our episode description. So now it's time to bring in the man of the hour that sort of helped carry you guys through this process, who I know you trusted a lot through caring for your dad, and that's Dr. Keller at Siteman Cancer Center. Dr. Keller, thanks so much for joining us.
Thanks for having me here. It's a pleasure to be here and to talk about your dad. He was really one of my most memorable patients, loved by all, and it was a great honor to take care of him and be there for you and your family through what I wish turned out differently, but was a long and I think we did some real good for him, even though things didn't end up like we wanted it to. So,
oh yeah,
and it's a pleasure to be here and talk to you and see you. And
yeah,
I said that I owe you hours of my life because I made you sit in the waiting room and wait on me for so many times. So you got all the time you need.
I really appreciate that. It's great to see you, but. I was going to get a gurney and some butcher paper and maybe a scale and have you wait out there for a little bit, send someone out to get your vitals, and then bring you back in about 20 minutes after we started recording.
Would have only been fair.
Yeah.
And then maybe I step out and then you sit there for another 30 minutes and then we're like, oh, you're still here?
One of the things I thought was impressive from the get-go, Patrick and I were also working together during the time of your dad's treatment, and he drove, as we discussed, every time from Springfield, right, which is 90 minutes.
Yeah.
Which isn't unheard of, but also shows the type of care he was coming to get, right? What was the things that you noticed the most about his attitude and his willingness to try anything when it came to trying to beat this? Yeah, I mean, I think both of those things were, in a sense, extraordinary with your dad. So he was a very smart man, I would say, and he understood what was going on, and he thought about things very analytically. And so he kind of looked at things and would weigh the pros and cons. I think he always had a sense, in my mind, I think, for kind of where, unfortunately, things ultimately were going. But yet he kept hope, and he kept a focus on the things that mattered to him in life. I remember towards the end, he told me he just wanted to go sit on a beach in Florida, and so we were doing X, Y, and Z and trying to set things up. And that was always a part of his approach, was that he was there to still have some quality of life as he went through everything that he did. And I think he did an amazing job of kind of balancing that. And that's not everyone can do that. To kind of put in the back burner what's happening and keep in mind that we're here to kind of live life while we have it. And I think your dad did that in just an amazing way. And then I can say without doubt that I don't think there was anything that we didn't try. I mean, we went through multiple clinical trials.
He was extraordinary in that regard. He went with, his prior doctor and my mentor, Dr. Jerry Lynette, out at University of Pennsylvania. He went out and did dendritic cell vaccines, and we were doing everything that we could, everything that science would allow. I think he was an amazing man. It was an amazing journey, and I was he met me when I was I just came out of fellowship, and he was kind of like, who is this guy? He had just, Jerry Lynette, who was my predecessor, had moved on to very senior position at a very big institution. And I was kind of the fellow that came out as first, and I'm pretty sure he had some conversations about me behind my back. I don't know about this guy. He says this, he says that. I think we really grew. That's the thing about being an oncologist, is that a lot of your patients kind of become your friends. And I really considered him that. And, I think that it was just an honor to take care of him, to know him. And he was, like I said, an incredible man that kept an incredible mindset. And we did incredible measures, to try and keep him with us. And we did. We kept him with us for a long time.
Yeah.
We had some great success. Not as much success as we would have wanted, but I think there's some really impressive things that we were able to do for him, through all that care that he got.
Well, he got to the beach plenty of times,
That's right.
I took him. We all went for one last vacation. I think 2 months before he passed away. We got down there, and I still, he had a beer and got out there in the waves and had as good a time as he could have. So you guys bought him a lot of time in Florida on beaches, that's for sure.
I'm always so amazed. People always say, I can never be an oncologist, because you're not always going to have patients that survive. It's not 100% guarantee. How do you get through that process of when you lose a patient? How does that make you feel when you go home at the end of the day? Or how do you get back up and just go, okay, well, it's on to the next one? I just think that mindset has got to be so... Do they teach you that in med school and fellowship? How does that work?
Yeah, no, it's not. I would say it's not taught enough. I think you don't know those skills when you first start. When I first started, it's very hard. I think that's a universal experience from the people I talk to. You have to kind of learn how to realize that, you did everything you could for someone and take solace and peace in that. But then there's times where it's great. So I had someone tell me once that, sometimes it's pretty ugly, sometimes it's ugly before it's pretty. And I think that is oncology. It is an ongoing issue inside of you, and you're never really at peace with all the suffering and things that you see, but you know that you're doing your best and you're helping a lot of people. And I think that's why you do the job, and that's what drew me to it. And it's a great honor to do it. I think you learn sometimes in med school, or you're surrounded, particularly at a place like Siteman, you're surrounded by these really smart, senior physicians, and you think, if I was smarter, I would have figured out how to keep that person alive, because that's kind of what they say, and that's maybe how you start. But then I think as you get older, or you get a little more experience, you start to realize that sometimes the disease is going to do what it's going to do, and despite everything we try, maybe we get some benefits, but we just can't change things. And that's, there's a bit of acceptance in that you just have to learn to kind of live with. And I think it's not just you as the doctor. It's the patient that's going through it. Mm-hmm. And you get to see how people like your father handle, these incredible situations as well. And that you learn from all your patients, for sure.
What is it about metastatic melanoma that has changed that's allowing patients to live longer? Or what treatments, or is it immunotherapy? What has changed?
There's kind of two things that have really evolved. But, the biggest thing, a decade ago, all we had was chemotherapy. And chemotherapy was not very effective at all.
On skin cancer.
In melanoma, and on most skin cancers, yeah, and particularly melanoma.
Yeah. And
we had the advent of immunotherapies, which got their start in melanoma. And the reason is nothing worked in melanoma. So these drugs, when they were first developed, the class of drugs called checkpoint inhibitors, they got their first test in their first trial in melanoma, because nothing worked in melanoma. Everything that they tried was not really effective. And so they were approved first in melanoma. And now they have just been approved through almost every type of cancer over the past 6 to 7 years.
Can you explain to those listening exactly what immunotherapy is?
Yeah, so immunotherapy, it's a complicated question, but immunotherapy, broadly speaking, is a way of tricking your immune system or harnessing your immune system into attacking cancer. And it's something that's been around for a long time, relatively speaking. So for patients with leukemias, we give transplants. So we give, we call allogeneic transplants of someone else's immune system. And the way that works is that the other person's immune system attacks the cancer in your own body. But particularly with the immunotherapy that we're talking about here, is a class of drugs called checkpoint inhibitors. And the way that works, the way I always describe it to patients is that just like our government has checks and balances to keep it in line, your immune system has checks and balances to keep it in line. And these are checkpoint inhibitors. They get in the way of these kind of checkpoints that keep the immune system in line. And it lets the immune system do things it doesn't normally do, like attack cancer. These drugs, and there's many of them now approved, can have just amazing results for a subset of patients. And that's what's driven up survival really across the board in cancer, and remarkably so in melanoma. And then we've also had some drugs that are called targeted therapy drugs. And these are drugs that are kind of small molecules. They're pills that people take, whereas checkpoint inhibitors are infusions. And these, particularly in patients with melanoma who have something called a BRAF mutation, have been able to really treat patients very effectively. However, the responses are typically kind of shorter lived. It's these immune responses that allow patients typically to go 6 years and more, like your father did. And so those are the ones that we've been really, really impressed with. And it's been just a total shift in the treatment of cancer, the nature of cancer research, because when I was in med school, it was all about this kind of targeted therapy, these small molecules, and now it's, that's still there, but it's more and more these immunotherapies, because your immune system is always there. I tell patients sometimes it's like you can turn cancer into like a pneumonia. Your immune system will attack a pneumonia, and that pneumonia is gone. And that's the hope and the dream of immune therapy, in a sense, in cancer. It's a simplistic view, but that's kind of what it is.
That's about the deepest I could understand. So
I was going to say, can I get a percentage on how much of that you understood?
Yeah, you're tricking.
You were nodding like you understood all of it.
Immunotherapy is tricking your body into thinking it has something. So just like with the pneumonia, it attacks the cancer thinking it's something else.
So we'll go with 75% for you, understanding that.
I never took a chemistry class in my life.
So you're saying I've been doing a bad job explaining this to all my patients?
Not at all. I was 100% with you. Man, I know all about the Mechanist and Taflinar and Opdivo. And
yeah, you had a crash course, more than a crash course.
He's bragging because
PhD.
he's had cancer, but I don't, whatever, okay? I think I have a pretty good understanding. I knew what stem cell transplants was in that other episode, like it was nobody's business. One of the questions I have, because of a history in my family, why does skin cancer have a certain chance of, like, if you have breast cancer, you have a better chance of getting skin cancer? Or isn't it connected with some cancers more than others?
Yeah. What melanomas and skin cancers are probably most connected with is any kind of immunosuppression. And this underlies how we treat them, right? With the immune system. So patients who have a history of immunosuppression. So some patients who are like patients with CLL, which is a type of chronic leukemia, which is a cancer, can have reduced immune kind of surveillance. And they have a higher likelihood of developing skin cancers. Patients who've had solid organ transplants, so if someone's had like a liver transplant or a kidney transplant, they have to be on immunosuppression to allow that organ not to be rejected. And they can have an increased risk of a skin cancer incidence and can have more aggressive cancers when they do occur. So that's the typical link that we kind of think of for these skin cancers in terms of their occurrence.
It's not because if it's on your skin, it can seep through and get to other parts of your body easier or something, like someone with my knowledge would think.
No, it's, that's a common thing, is that someone thinks, you'll ask a patient, right? You'll see a patient say, what do they die from? They died from lung cancer, but, they had a melanoma or a kidney cancer. These cancers start somewhere. And then if they spread somewhere else, they're still the same thing. Yes. So melanoma that went to the lung, is still a melanoma. It's right, metastasized to the lung, still a melanoma. And so, melanoma is particularly tricky because some cancers, there's a pattern, that they go. A cancer, when it spreads, there's this idea that it likes to find a place that's like home, and so colon cancer tends to go to the liver, tends to go to the bones, the lungs. But melanoma can go anywhere because there are these melanocytes is where it comes, where a melanoma starts. They live everywhere in the body, and melanoma is at home everywhere. And so it's a particularly nasty cancer when it spreads because of that, because it can really pop up anywhere. There's not really any rule book that follows, unfortunately. So.
Typically speaking, when melanoma has internalized, it is thought to have been one of the more deadly cancers. Isn't that right?
I mean, it was, right? And we're changing that because of our treatments. It can be a very aggressive and deadly cancer when it spreads. With these new treatments we have for many patients, we're now able to get it under control and kind of turn the tables on it. Not for everyone, unfortunately. It's a very dangerous cancer when it spreads, which is why it's important. Prevention and catching it early are probably your best treatment options, but it doesn't work for everyone.
So you just mentioned that other than prevention, the treatments have increased, but prevention with skin cancer is, when you compare it to other cancers, obviously the sunscreen, obviously staying out of the sun. I get a skin cancer check every year. I grew up I was born in the 70s. I was putting the baby oil in my teenage years. I was going to the tanning beds. I wouldn't be caught in a tanning bed for any reason now. I mean, there's sunless tanning places you can go to. Prevention, prevention, prevention. I'm sure you'd like to tout that on this podcast.
I grew up on the lake, on boats. I was like a sailing instructor, lifeguard, and drove around in a Jeep with no top on for, most of my childhood, adolescence, what have you. But
You were cool.
I thought I was cool. I wasn't. I've never been accused of being cool in real life. But, so I had a lot of sun exposure, a lot of sunburns. And so now I'm scared also. And now I'm a melanoma doctor, right? So it's even worse.
Yeah.
Yeah, I mean, I think you're right. The best thing we can do to try and prevent melanoma is to try and reduce UV exposure. UV exposure is probably the number one risk factor. When you look at the incidence rates, it's actually it's like alarmingly common. I think it's about 2% of the population that'll have. In Caucasians, it's different by race and so forth, but in Caucasians, it's about 2%, I believe, that'll have a melanoma over their lifetime, which, you think that sounds rare, but that's actually not really that rare. So I think, being cautious, put on the sunscreen, wear a hat, minimize sun exposure as best you can. That's the best thing we can do. If you have kids, my kids, they hate me, but they get like tons of sunscreen, hat on all the time.
I bet you don't put sunscreen on them and let them get right back in the water either, do you?
Sometimes kids you can't control.
But do you coat them up before you even get to the pool?
Yes, typically.
Yes.
No one's a perfect parent, but I do my best.
Let's talk some misconceptions that I'll hear a lot when we talk about skin cancer. If you have a darker colored skin, let's say you're of a Latin descent or Indian or you're Black, are your chances decreased of getting cancer? Or should you still be doing skin cancer checks?
You should still, regardless, you should still be doing skin cancer checks. And, if you have a concerning lesion, you should get it checked out. Incidence rates do vary by race. And so, but no, you should be cautious of UV light and exposure regardless. I'm not a dermatologist. I have to watch what I say. I'm an oncologist. I look at PET scans and CT scans. And that's every cocktail party I go to, someone says, what is this? And I have no idea.
Take a look at this real quick.
Exactly.
Oh my God. It's like Jaws. People are just pulling back
right.
Right. Yeah, that looks bad. You better get that checked out.
Right.
Yes, regardless, we should be watching ourselves. We have kind of a sun worshiping culture. And I get that. We all like to be out in the sun and enjoy ourselves. And you can do it safely.
I'm always interested to hear this answer from anyone in the cancer field as far as doctors are concerned. What do you feel like sets patients up for their best success when they're fighting? And also, because Patrick has shared what it was like to advocate and care for his dad, what you feel is the best advice for someone caring for someone with cancer. So it's kind of a twofold.
Yeah, I think just like with the incidence and occurrence of cancer, there are factors that we can adjust for, and there's some things that we can't adjust for, And so what are the things that in a certain patient can put them in the best situation? I mean, one is their attitude around it. I mean, that's 100% true. I think, patients that take their symptoms seriously, that kind of seek out help and are honest and communicative with you about their needs are going to have a better course through their disease. And, patients that have an advocate, like Patrick here, was a key thing. Someone who will help you walk through the possibilities. That'll say, sometimes a patient comes in and like, oh, I'm eating fine. And then you hear, what, I always say, if someone's there, what's the real story, and they're not eating fine. They're not doing well. And so that kind of outside informant is helpful for the doctor, helpful for the patient. And, sometimes they throw up ideas that are really valuable for the doctor and everyone involved.
Named the number 10 cancer center in the nation by U.S. News & World Report in 2022, Siteman offers safe and effective brain tumor treatment provided by some of the nation's leading experts.
Powered by Washington University physicians, Siteman's Brain Tumor Center is creating better outcomes for adult and pediatric brain tumor patients.
If you're interested in learning more, click the link in this episode's description.
What do you guys remember about the end of his journey and what that conversation was like? I'm not trying to get anybody to cry. I'm just saying that there are people that are going to have to hear this from their doctors, and the family members are going to have to hear it when it was, there's just nothing left we can do. What do you guys remember about that, and what helped?
Well, I'll tell you what I remember about it. Dr. Keller would always say, I will always treat you if you want to be treated. There will always be a treatment option. It's just there needs to be a conversation about the ramifications of that treatment, how it could potentially affect quality of life. So, and my dad he never wanted to give up. So it kind of came to the point with my dad where, as painful as it was, I feel like I had to talk him into hospice because we ran up against quality of life dropping off. We were, towards the end, it was just, things started to give. It was tough to get him to transition into end of life care because to him that meant like quitting and giving up. But you've worked in hospice.
Yeah. I don't know that enough people give, and Dr. Keller, I'd love to hear your thoughts on this, enough reverence to quality of life. I think sometimes people think you got to fight till the end. And there is some people that make the decision to say, I want a quality of life for the certain amount of time that I know that I have, or I want. And there is a space for we've talked about this in other podcasts, there's a space for a real beautiful quality of life towards the end too. So what are your thoughts on giving people permission to have that, to say, I want a quality of life for the remainder of whatever I have?
Yeah, I think it is the ultimate goal of any of your doctors, any of your team, to give you the highest quality of life for the longest possible time you can. And, oncology is tough because you don't want to do too little, you don't want to do too much because you can cause harm on either side. And so you try and hit it down the middle every time, but, it's hard. Sometimes you're off to one side. Every patient is a little different in how they approach things and what they want. And some are, hey, I'm never going to give up. And some are more open to going on to hospice and not going through all these things that, everything we do has a side effect, right? There's
a cost for everything.
There's a cost for everything we do. And I think what you said was kind of key, though. Your dad never wanted to give up. I always try and phrase hospice as what it is. Hospice is not giving up. It is treating this disease in a different way. And, when you've come to the end of a line of all these many therapies, and we're not seeing real benefit, focusing on comfort, on quality of life, on pain control, on time with family, on all those things is probably the best use of your time. Mm-hmm. It's hard, though, because that decision, I think, has to come when it's right. It's up to your team being led by you, the patient, to decide when it's the right time to move that way. And like I said, it's different for everyone.
Yeah.
It's a very tough and sometimes contentious thing that happens around the end of life. And so,
especially within families, who's ready and who's not, right?
That's right. Yeah. You're not just treating the patient in a lot of these situations. You have to kind of listen to everyone. And so, we always, in the hospital, and also as we do these family meetings and everyone sits down and we talk about, you get everyone's impression of where they think the cancer is and where we're at with treatment. And sometimes they vary wildly,
Yeah.
And so that's a tough thing to bring consensus in a difficult situation like that. But that's the nature of this problem. It's not an easy one.
Every family's different. Every patient's different, like you said. And
right.
I can tell you from my own personal experiences with hospice, both volunteering and as going through it with multiple members in my family, it's been some of the most beautiful experiences I've had. Mm-hmm. The permission to sit with someone and hold their hand and get the music therapy and, massage therapy and just be with them and love them and let them be peace. It happened with my grandfather. It happened with my aunt. It happened with my best friend's dad. It happened with your dad. Mm-hmm. It's a gift if you can give that person permission to say you fought the good fight and we're just going to love you through,
Absolutely.
your end process.
It's what most of us think of as caring, for someone. It's not the lab draws and the CT scans and the infusions. It's the sitting there with someone that you love and care for and taking care of them, in their time of need. I mean, that's it's a tough time, but it's also a great time to be able to be there for someone.
Well, and I didn't really know what hospice entailed, honestly, until my dad went through it. Your efforts to stop the cancer are stopping. You're focusing your efforts to, make
the next phase.
Yeah, it's the next
Right.
phase.
Yeah.
Now, what I learned about it was, all the benefits of it. It's like immediate intervention on all these things that normally, if you're not in hospice, it's, a visit, a prescription, it takes time. Whereas, these hospice nurses are authorized to immediately prescribe what is needed for ultimate comfort. So I just remember my dad's apprehensions about it, and he would go, Pat, I'm telling you, my mom went on hospice and 2 days later she died. And I would go, probably because she's
Waited
a
so long.
stubborn Irish person like you. And if you keep waiting, that's what's going to happen. Instead, we got him in a hospice, and he had, we had like 2.5, 3 months at home.
Yes.
I worked remotely, helped him clear out his office, helped him finish up some paperwork, talked about what's going to happen with his business and finances, and bringing my mom up to speed and transferring ownership of accounts and closure. It gave us the opportunity to get as much closure as possible. Whereas, if we'd kept going, he would have died in a infusion chair at Mayo Clinic because he just wouldn't relent. And so, yeah, inevitably it took a conference call with 4 people because I couldn't be the bad guy.
I know.
And fortunately, they all the people took that job from me. They took that burden off of me rather by making it clear that they advised him that this next potential clinical trial would likely do more harm than good. So that didn't have to come from me, but I did kind of have to rally the troops to lay this presentation before him to help to make his decision a little bit easier.
Yeah.
There's a saying in medicine, it's don't just do something, sit there, And sometimes that is the best thing we can do is to do nothing, kind of sit there with someone and be with them. It's not always the right thing to do more, and so there comes a time where you have to transition.
I think we all know and have heard by now that smoking is not good for your health, and it's one of the leading causes of lung cancer. But did you also know that it's linked to cancers of the head and neck, bladder, breast, kidney, and more? But if you do smoke, the good news is that within 2 years of quitting, the risk of those smoking-related diseases can begin to drop. And after 10 to 20 years, the risk of lung cancer and most other tobacco-related diseases nearly equals that of non-smokers. But listen, we know it's not always easy to quit.
No, I used to smoke, and I can tell you from experience that once you stop smoking, you feel so much better. I mean, imagine a year or 2 down the road, you feel like a new man.
If you need some help, luckily, the Smoking Cessation Program at Siteman Cancer Center offers a wide variety of resources. If you're interested in learning more, just click the Smoking Cessation Program link in this episode's description. What have you learned from your job so far? I mean, you did your fellowship and you're at Siteman. What have you learned so far in this journey of yourself being an oncologist, and what are you excited about in the advancements of how to treat your patients?
I'm going to start with what am I excited about the advancements of treating my patients, because that's a much easier question. So, I think in treating the patients, this is a very exciting time in oncology and cancer care. I'm lucky to have kind of stumbled into it in my medical career. But we are right now looking at a lot of different ways to harvest the immune system to treat all kinds of cancers. And we're looking at moving these immune therapy treatments earlier and earlier in a patient's care. I mean, I'll tell you, it's not impossible to foresee a future where surgery and radiation treatments are going to have a different role than they do now, because we might be able to alter the nature of cancer treatment with some infusions of an immunotherapy drug.
Versus cutting out the skin first and then treating.
Yeah, don't tell any surgeons that I said that, but but it is. We're doing our treatments more and more before surgery, and we're seeing amazing results. And so I have to put a plug in for patients. If your dad was very open and aggressive about participation in clinical trials. And that is not only how we make lives better for some of our patients, but also how we learn and advance our science and our care for other patients. And so if you're out there and listening and not sure if you want to participate in a clinical trial, I mean, that is the key of how we advance cancer care and make it better for generations to come.
And Siteman's a huge research facility.
And it is a huge resource to this community and the surrounding area. I mean, it's telling that, your dad was willing to drive, so far. And I think he had gone, I think when I first came there, he had gone up to Chicago and, but I think that it really is an amazing place. We're lucky to have it. We're lucky to have all these options for our patients. And I've been lucky to see how things have changed and all the benefits that have accrued to patients. What have I learned about myself? I'm going to come back. I didn't forget about it.
Yes, thank you. I wasn't going to let you get away with it.
That's a tough one. I have learned, I don't know how deep you want me to go here.
Go deep. That's what we're here for.
Do I have to, you're going to charge me for therapist hours?
I almost cried about hospice, so you're up.
Well.
You did cry about hospice.
Whatever. I didn't cry.
Personally, I've learned I can't help everyone, right? I can't be kind of everyone's savior. There's times where you're going to fail, in a sense, to get the outcome that everyone wanted, and that's going to happen. As you go through a cancer treatment, there's going to be bumps in the road. There's going to be unexpected things. I mean, your dad was in the hospital numerous times, right?
Yeah.
Like we did a lot of things, but sometimes bad things happen, and you can't stop those bad things from happening. And when I first started, every little bad thing ate me up, inside. And as I've moved on in my career, I've learned that, you're doing everything you can. You got to learn from it so that you can be better the next time and help the next patient.
I think it's really important for patients to recognize that the doctors are people. I think more often than not in this dynamic, it's the onus is on the doctor to treat every patient as a unique individual and put themselves in their shoes. And, I think that cuts both ways. It should. Every time we had a consult with my dad, it was a conversation.
I think you're absolutely right. It's I don't have a crystal ball. I have experience, I guess. I've been down this road more times than the patient has, right? But I've never been in the patient's shoes. And so you're right. That's how I hope I always come across. And doctors are not perfect. We want to be perfect. I think we're really good, okay? Yeah. Don't get me wrong. I think Siteman is filled with just amazing doctors and clinicians. But I think we are all trying to do our best and keep hope together, stick with it, and we'll get there as a team, I think is our approach. So.
Well, as someone who cares very much about Patrick and who has heard so highly of you, I'm so glad that you were there for him and for his dad. And I know he's said nothing but good things about what you did for his family. So I appreciate that, and I appreciate you being here today. And Patrick, I will let you have the last word. It's
been very insightful to hear, your perspective on all this stuff. And we went through 6 years of, treatment with my dad together. And I just really appreciate you coming in and sharing your perspective. And on behalf of my dad and our whole family, I really, really appreciate everything that you and Siteman did for him. I mean, you guys kept him around for a long, long time, gave us a lot of good years with him. So thank you very much.
I want to say one thing. I'll never forget the visit when your dad came in and told me that you had been diagnosed with cancer.
Yeah.
He was by himself that time, and he didn't show a ton of emotion throughout this process. He was a pretty kind of stoic, tough guy. But I think to know that you were going to go through some form of a battle like he had, he was so it tore him up. And I can tell you, I'm so glad you're doing well, and that he would be so thrilled, because the thing he told me was, he said, I just wish I could take it. I just wish I could take it from him and take it on to me. That's just all I want. And he was, this, but he loved you deeply, and he was a really great man. And
Well, thanks.
I was very blessed and lucky to be able to take care of him. And I wish only he was still here with us.
Oh, man, absolutely. I mean, you said something earlier about when you came on to his case, because we were with Dr. Lynette first. And I think you said something to the effect that, like, you suspected there was probably some back channeling or whatever. But he definitely, I would say, at least for the first 2 meetings with you, would, in a not so delicate way, be like, now what's Dr. Lynette have to say about this? I'm assuming he's going to be chiming in on this. And you did right by him all the way through, and you tolerated his probably less than delicate second guessings early on. But I hope that you came to realize, because it was very clear to me that he had complete confidence in you. You were our guy,
That means the world to me, because that's what all of us do this job, to be there for people and to be trusted. And by the end, I know we were buddies, and he said some very kind and wonderful things to me.
He's probably up there right now making jokes down at you guys right now, and waving his Cubs flag, and
man.
I wasn't speaking for a couple minutes because I was crying. But anyway, I'm gonna, because it's just so sweet that I'm sure he said that. I'm sure he was in there. And so,
Yes.
I sat with him during your surgery, and he was trying to be so calm, but I could see the worry on his face.
Yeah.
And I know how much he loved you. So I'm going to stop, because I'm going to start crying my eyes out. And Dr. Keller, I want to thank you so much for being here, and for being here for Patrick's family, and letting us just hear more about your relationship with him. And I'm glad you became an oncologist.
Thanks for having me. It's been my pleasure. It's been great to catch up. We should catch up,
Yes.
outside of a podcast sometime.
Absolutely.
Because we've had a long battle together. So
Yes, 100%. Thank you again, Dr. Keller.
thanks so much.
Thanks for listening to This is Cancer, brought to you in partnership with Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis, national leaders in cancer.
For more information on Siteman Cancer Center, go to siteman.wustl.edu. Be sure to leave a review and like and subscribe wherever you listen to podcasts.